next, and we are running not too far ahead of time, about 5 minutes. That's good. The Hamilton County Health Department is going to be doing a healthcare panel, and Sabrina Novak is the administrator. Diana Kreider is the director of clinical services. I'm starting to see people's faces, live faces pop up with this. Janie Burley is the epidemiologist. Megan Sloan is an epidemiologist. I'm not sure who all is actually here right now. Renee Craig is community outreach program manager. Ezequiel, did I say that correctly? Ezequiel Garcia is their health information specialist, and Holden Young is their communications manager. So what they're going to be talking about today is Health Department 101. I love this topic, a public health snapshot. So thank you all for being with us this morning and presenting your information. We're looking forward to hearing from you.
Good morning. This is Diana. Can you hear me okay?
Yes, absolutely.
Great. Great. So I'm Diana Kreider. I'm the Director of Clinical Services here at the Health Department. As Amber said, we have a group of folks here to share information with you. Unfortunately, Sabrina Novak is not able to be here. She's having to be down at the County Commission. So she sends her good wishes. And I do want to say it's a hard act to follow Ray Bond. We so appreciate Project Access as a community partner. Just wanted to share that a little bit. I'm going to talk just briefly about Public Health 101, as Amber said. I'm thinking before the pandemic, before COVID came along, most people didn't give much thought as to what public health was. So I'm going to kind of do the boring part and give you a little information about us. And then I'm going to turn it over to our team. And they're going to talk about, from our epidemiology perspective, some data, things that happened during COVID, and then our outreach staff being out in the community, some lessons learned that came to us as we went through COVID. So I want to just say, if you think about public health, and let's talk about nationwide, public health, the building blocks of public health are three main things: assessment, assurance, and policy making. So in all areas of the country, that's one thing. Those are things that public health does. What they do on top of that is typically based on what's going on in that area. And I'm going to go ahead and share our screen here with you. So hopefully you all can see that okay. So, we'll go on to the next one here. Excuse us just a minute. We're having a little bit of a technical glitch here. And I'm thankful for Holden, who's here making this work for us. Okay, great. Yeah, so as I said, can you see that?
Yeah, we can
Good.
see it. And
Okay.
Holden, we can see the next slide as well. So you might want to do it so that it's just the main slide.
While he's working on that, let me go ahead and talk. So here in the southern part of the country, in addition to those three building blocks, typically public health has been a safety net provider, and we provide a lot of direct services that's not typical in maybe other parts of the country. So I'm going to share a little bit about what some of those services are here in just a second. In Tennessee, public health is under the Tennessee Department of Health, and the state is divided into regions, and we have what's called rural regions and we have metro regions. So Hamilton County is a metro region. And as you can see from the map, the way that the state's divided up is they group counties geographically, and often in the center of those, there's a metropolitan area. What that means, essentially being a metro health department, is that locally, there's a lot of shared response as far as fiscal responsibility and decision-making responsibility. So we work very closely in tandem with the State Department of Health, but typically all of us that work here at Hamilton County, we're county employees, and we fall under the county mayor and the county commission. So So if you look at our facility, and Ray kind of alluded to this, we have 5 what we call satellite, 4 satellite sites, and then our main facility. So we have a very small clinic that's up in the northeast part of the county. That's our Birchwood Clinic, and that does provide primary care as well as traditional public health services. We have a clinic in Saudi, which is our Sequoia Clinic, and we have one in Ottawa. We have our homeless healthcare facility, which is located off 11th Street, and that is an FQHC, as Ray said. We provide medical services as well as case management services there, and the total focus of that is the homeless population. Then here at our main facility at 3rd Street, and by the way, that's located right next to Erlanger Hospital, we have 5 what I call specialty clinics within our facility. That would be like our STD clinic, our TB clinic. We have a large pediatric clinic, and then we have a family health adult clinic, which is mostly family planning services, as well as an immunization and overseas travel clinic. Then in addition to our clinical services, we have a lot of program type services here at Hamilton County. So just as showing our mission statement, and our motto is typically what we focus on: working towards a healthy community. This is just kind of a quick overview of the organizational structure of our health department. And as you can see, we're connected to the State Department of Health. We're connected to the County Commission and the County Mayor. We also have a regional health council that serves as an advisory group that works with us. In some regions across the state of Tennessee, health departments have what they call health boards, which actually have an authoritarian role and decision-making role in actual services and programs delivered. So within our health department here, we have 5 divisions. We have one that's a support division that just allows us to be able to function. We have our community health program area. They do a lot of work out in the community, a lot of education, as you can see, tobacco prevention and use, step 1. We have a case management division, and they do a lot of social type services, case management, mostly with families and children. We do have a community assistance service program that we can work with residents of Hamilton County to help with things like rent, possibly groceries. The main purpose of that is to assist families, but also to prevent homelessness. We have an infant mortality reduction and prevention program, works community-wide. Then we have our clinical services division, and that's basically broke down into 3 main areas. We have our communicable disease service area, we have our maternal child health service area, and then we have dental services. So if you go to our website, you can look up and see what all the individual services are. And I do want to say that in the clinical area, there are fees for all the services that we provide. And some of the services we're able to provide on a sliding scale fee system, which could be anywhere from 0 to 100%, or it could be some of the programs have minimum requirements like 30% pay. We do accept TennCare, and we also accept insurances, or most insurances. Then we also have our environmental health division, which is things like restaurant inspections, swimming pools, rabies control, that type of thing. So this is just a slide that kind of shows a little bit about the direct services. I want to comment on one of the big services that people are probably not aware of, is that we do have a role in community response for disasters, which would be most often natural, but also man-made type issues. We employ a lot of different types of workers here at the health department. This is just kind of an idea, give you an idea of who works with us. This slide here just kind of shows you how you can get information from us. That's our main website. And then we have, and this has happened basically through COVID, we have a pretty robust social media division or focus, and a pretty robust website, I think. We also have a hotline, which Renee is going to talk about a little bit later, but I do want to say that we implemented that probably March of 2020 at the beginning of the pandemic. And that's probably one of the best things that we did, I think, as we rolled into this kind of dark and deep time. That hotline initially ran 7 days a week, and we received all sorts of calls and provide lots of resources for that. Pre-pandemic, if you think about public health, these are some of the things that you think about. I do want to say that a lot of people don't really understand what public health is and what it does. And one of the things that I ask when I am interviewing people to hire is, tell me what your understanding or your definition of public health. And basically that kind of quick definition is, we're here for the health and well-being of the community. So that could be from an individual that we would be serving, a family, or it could be a street in a neighborhood, it could be a zip code area, and it can also be the entire county of that we focus on. So in talking to people, if you think about it, so if you work at a hospital or a physician's office, your patients or your clients are the people or families that come in the door that you see and provide direct services to. We have those types of clients that we serve as well, but also our client or our patient is the entire community. And I think that became very evident as we rolled into COVID, that we had to think in those terms. So some of the great things that pre-pandemic people might have thought about public health were vaccinations, and that was a lot of prevention work, and things like measles, mumps, smallpox, motor vehicle safety. I don't know if people think about this as a great achievement of public health, but motorcycle helmets, car seat safety, seat belts, just an engineering of development of how roads are set up from a safety perspective. Safer workplaces, control of infectious disease. Think about TB, STDs, COVID now, as we've been working with that. Also, done a lot of work in coronary heart disease and stroke, safer and healthier foods. If you think about, like I said, restaurant inspections, but also things like food supplements and preventing things like rickets, which you never hear anymore, goiters. Healthier mothers and babies. That would include things like infant mortality, maternal mortality. And I do want to say that that's a lot of work that we've done with community partners here. In Hamilton County, we have had the issue of having a higher infant mortality rate, a higher low birth weight rate in our infants. And we have that rate was higher than the national rate, higher than the state rate. And so that's something that we've worked on for about 10 plus years. And we've actually made good inroads in that, as to where our rates are at least lower than the state rates, lower than the national rates, but we still have a lot of work to do there. Family planning, which is a reproductive health program, is something that has also been a huge part of public health. And things like, if you think about that program, provides free or low cost birth control, planning and spacing of pregnancies, which actually impacts financial health as well as physical health, mental health, and really promoted and changed the roles for women in the socioeconomic sector. Also, we've worked with prevention and work on tobacco reduction in the community. And one of the biggest things I think that, and I'm sorry, I can't remember the year, but when we moved to having no indoor smoking, think about what a big impact that's made on our community. Pre-pandemic, when you think about community response and what the health department has participated in, it's been things like response to tornadoes or receiving evacuees from hurricanes, working with parts of the community where maybe there was an apartment fire or people lost housing. And these are actually pictures of some of the responses that we went to. The picture of the pickup truck in the lower left corner, that was actually from the tornadoes. There was a series of tornadoes in the Appleton Collegedale area. We sent out strike teams with law enforcement, and we went out with a nurse and a social worker, and we took water and tetanus vaccine, and we did assessments on people immediately after the tornadoes. So with the pandemic, our community response shifted and changed a little bit, and we worked with community partners to do things like set up a lab to do testing when there wasn't testing immediately available at the start of the pandemic. We provided masks early on in the pandemic when supplies were not readily available. We set up testing sites throughout the county, and then we ended up having a mass testing site that ran for almost a year down at the riverfront at Alston. When vaccines came along, then we started setting up vaccine sites. We did mass clinics. And at one point at our largest pods, we call them, we had 3 sites running full-time, 7 days a week. And we had the capacity of doing almost 9,000 vaccines a day. So as community providers started receiving resources like vaccines, we adjusted that, and we've moved back into less mass type clinics, and trying to work with our partners. One of the things that we did during the pandemic early on was we implemented what we call a COOP plan, which is, it stands for continuity of operations. And that basically meant that we took all our resources, we shut down our regular services and reallocated those resources to do these very things that I was sharing with you about the response. And you'll hear a little bit more about that from Renee and Zeke. So sign of the times, we're still working with the pandemic. We're moving from it being a pandemic to probably what we call an endemic, and we're learning to live with COVID. We're trying to figure out how we get our services back up and into the community, and what we're going to look like when we do that. So at this point, I'm going to turn this over to our epidemiologist, Megan and Janie.
Hi, my name is Janie Burley. I'm one of the epidemiologists at the health department. Just give you a little bit of background. I graduated with my MPH from UNC Greensboro in 2014, and upon graduation joined the health department as actually a public health prevention specialist working in tobacco prevention before becoming a hepatitis coordinator in epidemiology in 2018. And then in July 2020, I moved into the role of epidemiologist.
My name is Megan Sloan. I received my MPH from UTC actually in 2020, and I came straight into the health department during COVID-19 to help with case investigation. I eventually moved into the role of hepatitis C coordinator, and then eventually into the epidemiologist role like Janie.
Okay, I'm going to just talk to you a little bit about our epidemiological response during COVID. The slide that you can see on the screen right now shows the number of daily cases from the beginning of the pandemic in March 2020 to present day, with the key moments. As you can see, our numbers initially were low until mid-June, beginning of July 2020. On July 4th weekend, we were aware of many social gatherings due to the holiday. And after this weekend, our daily case count started to increase. On July 10th, you can see that that's when the mask mandate was enacted in order to try and limit community spread. However, our case count did not start to decrease until the end of July. You can then see the 3 surges that we have experienced during the pandemic: Alpha, Delta, and Omicron. Alpha, the variant that was initially identified in the United Kingdom, produced some significant daily case counts and only started to decline once vaccines became available in December 2020 and the beginning of January 2021. We then saw our case count drop, and then we see the next surge, Delta. This variant was initially identified in India. Delta proved to be more transmissible and more severe than Alpha, and unfortunately, we saw an increase in COVID deaths with this variant. The last surge depicted on this graph is Omicron. Originally identified in South Africa, Omicron was even more transmissible than Delta, and therefore, as you can see, we saw a much steeper curve for the number of daily new cases. However, as we saw in other areas of the country and the world, the decline in the number of cases also dropped more rapidly than the other two surges. So during the COVID pandemic, we focus on collecting data, and we did this through conducting case interviews with the cases in our community, and Megan will touch a little bit more on how we did that in the slides later on. How we then put this data into a REDCap collection tool. This is where we enter the data collected from those interviews with the cases. When the pandemic started, we conducted extensive case interviews focused on contact tracing in an effort to try and actually stop the pandemic. However, the case counts increased, and our case interviews became focused on controlling the spread rather than stopping it, and providing a lot of guidance and education to cases and contacts. I will talk a little bit more later on how we utilize this data that has been collected to create the visualizations that you can now see currently on the Hamilton County Health Department website.
Another data collection tool that we use in our epidemiology department is what we refer to as NBS. This is the CDC's national database for tracking all reportable diseases. In addition to COVID, NBS holds the case investigations for things like Lyme disease, hepatitis, salmonella, etc. The records in NBS are quite a bit more extensive than our REDCap tool and include very detailed questions like symptoms, pre-existing conditions, and enhanced mortality surveillance. Every positive COVID case in Hamilton County has a record in both NBS and in REDCap. Here's a very brief overview of what our epidemiological COVID-19 response process has looked like for the majority of the pandemic. Our department receives positive antigen and PCR COVID labs from providers across the county, like hospitals, doctors' offices, and labs. And this patient information is entered into REDCap and assigned a case number. Case investigators pick up cases from a table in our epi wing and sign out the case using the case number. Cases are interviewed using a paper data collection tool we refer to as the case report form, which includes questions like symptoms, where the case has been over the last 14 days, and who they may have come into contact with. After a case is interviewed, the investigator places a copy of the interview in the NBS basket, and a member of my data entry team will enter the information collected during the interview into both NBS and REDCap. After all relevant information has been stored digitally, the paper copy of the interview is then shredded to maintain patient privacy. And now Janie's going to talk a little bit about what we do with that data once it's in our databases.
So on the left-hand side, you can see a screenshot of the Hamilton County Health Department website. This shows our daily case count and several graphs that depict daily case counts and then hospitalizations. And then we have some maps at the bottom that our GIS team from Hamilton County put together for us to show where the cases are within our county. We are able to extract that data from the REDCap tool that I mentioned earlier, and through an analytics portal that we developed with Hamilton County IT department, we can show this data in the form of these interactive graphs that you see on our website. For most of the pandemic, we were focused on daily case counts and total case count numbers. But recently, when our case count numbers dropped and with the increase in at-home testing, we decided to move the graphs depicting our hospitalizations to the forefront on our webpage, as this is a true reflection of the impact of COVID in our community at present. The picture on the other side, on the right side of the screen, this is the Tennessee Department of Health webpage, and they have many different places you can click on to see some syndromic surveillance, the vaccine, our county snapshot as well. And so there are two places that we can look at our communities, how our community is faring right now during the COVID pandemic. We just wanted to show you this slide. This is a picture of our health. It's a report that was last issued in 2019. The report is a broad picture of the health of Hamilton County residents compiled from local, state, and federal data sources. This report is a useful tool to evaluate the health of our community and to guide our efforts in targeting prevention initiatives, improving healthcare, and influencing public policy. It shows us what is working well and where we need to focus our efforts. This report documents over 100 health status indicators of Hamilton County residents, including but not limited to leading causes of death, infant and maternal health, injury and violence, substance abuse, and environmental health. As I said, this report was last published in 2019. On the right side of the slide, it shows some of the bright spots and the areas of concern from the 2019 report. For the next report that will likely be produced in 2023 due to the pandemic, it is anticipated that we will see mental health issues and substance abuse as key areas of concern. Apart from the obvious physical impacts of COVID, researchers are seeing that many people are struggling with the immense emotional and societal changes the pandemic brought, and are finding it hard to adapt to a new normal now that restrictions are starting to ease.
While the data in our 2019 picture of our health report is pretty dated by now, you can find updated county level health data from several other sources. County Health Rankings is a really great option. That's what's pictured there on the left. Another great source that I did not add to this slide is the Institute for Health Metrics and Evaluation. Their URL is just healthdata.org. Another similar URL is healthdata.gov, which is a Department of Health and Human Services managed site that's a really good aggregation of large data sets that you could use in projects or reports. Knowledge of health outcomes in your city or county is really important for those of us in clinical care or in public health fields, because identifying negative outcomes or gaps allows for a targeted approach in health education and promotion. And with that being said, I'm going to turn it over to our Community Outreach Program Manager, Renee.
Good morning, everyone. I'm Renee Craig. I am the Program Manager for the very new department known as Community Outreach here at the Health Department. Our Community Outreach team came out of the COVID-19 response when we very readily realized that while we had this great reach of doing mass test sites, mass vaccine sites, it was just as important that we go out into the community and bring our services there for testing and as well as the vaccination. So I'm going to give you a little brief history of how our little team came to be during the COVID-19 pandemic response. And we sort of start with the hotline. I can take you back to the very beginning and this tells you a lot about public health and what to expect if you work in public health. So the morning of March 4th, I was actually dressed in a honeybee costume and at a preschool in town doing education on the importance of honeybees in the food system to 3, 4, and 5-year-olds. Had them wrapped around my legs. We were singing and dancing and just having a wonderful time. Meanwhile, behind the scenes, our administration was keeping a very close eye and monitoring the COVID-19 and the cases and what was happening in the community. And sure enough, 6 o'clock that night, I got a text message from my director, Renee, Nashville's about to report its first case. We need to enact the COVID-19 hotline. And we had that hotline up and running by 11:20, March 5th of 2020. And the governor announced the first case in Tennessee at 12 o'clock. And that first day we took 21 calls. Basically, it was the questions were, what do we do to protect ourselves? And we were saying, wash your hands, clean your surfaces, cough into your sleeve. That very quickly changed as the cases increased. That 21 calls on that first day then became on our highest call volume day, almost 1,700 calls during that first week when we were doing the COVID-19 vaccines in December of 2020. Our total calls have been well over 200,000. This has been a lifeline, not only to the community, but to us. So we make our hotline very accessible to people. We always have bilingual people on staff, as well as a language line. We have a nurse available to answer and assist with medical questions. But in addition, we get valuable information from the public that we take to our epidemiology team. The hotline was one of the first to learn about clusters in businesses and preschools and daycares and schools that we could share with epidemiology very quickly, as well as we could notify administration when there was testing backlogs or issues. So we've used the hotline very much for ourselves during the response as well. And then as we moved on to testing, Diana, told you about our large mass testing sites at the Alston plant. But this is where we really we started to see, this is wonderful, we can get thousands of people through here. But how are we going to reach our most vulnerable neighborhoods? Are people comfortable, even though we provided free transportation and ASL services and bilingual services, there was still that segment of the population that wasn't comfortable going to our test sites. So we had a team that worked very closely with our African-American churches and leaders. And during the summer of 2020, we partnered with those churches and did over 7,000 tests over 12 weekends, actually taking it into the neighborhoods. And they were so appreciative of that. And we really started to see an uptick in people trusting us and realizing what the health department was there for. And in addition, we partnered with the school system and used the schools, which is a very trusted member of the community. And we would go to the schools when they were closed down over the summers to offer free testing as well. And then we moved on to our free test kits, which we've been distributing throughout at all of our clinics, as well as at our outreach team. So we're doing everything we can to get all of our services into the community and make this as accessible and easy as possible for our residents to get the services that they need. Then we moved into vaccine in December of 2020. And as Diana said, we had the mass vaccine sites, which again, we offer free transportation, ASL and bilingual services at multiple locations while they were needed. But this is where we learned, we took in those valuable lessons from the testing where we were going into the community, that once again, we needed to do that with the vaccine to our most vulnerable communities. And we started partnering with Chattanooga Housing Authority neighborhoods, nonprofits like Goodwill, the Food Bank, to actually take small teams. We don't do hundreds of vaccines at these events. They're very small, but we're going into neighborhoods where we're trying to build relationships and build that trust between us and the residents. And it's a very valuable part of our response to the COVID-19 pandemic. And it became so valuable to us that we actually created this program, this community outreach program, where we're very excited about how we can use the same model moving forward as we get through the endemic, as Diana referred to it as, and we start opening our other services. How can we then take these lessons that we've learned? I just want to give you one very brief story to show you how important these outreach teams are. We were at a Chattanooga Housing Authority site several weeks ago, College Hill Courts, and I was outside talking to the residents and letting them know why we were there and that we were offering vaccine. It was a pediatric vaccine event. And we had a mom and her son, very confident, 10-year-old boy, came up, and I started to say hello. And he was like, "My mom is deaf. I will need to speak for us." And I was like, "Well, oh, okay, well, hold on just a moment." And I went inside and I got Zeke, who knows American Sign Language. And he came out there and started communicating with the mom. And I have never seen a woman more excited. just the look on her face and the time that she took. At one point, I looked over and Zeke was FaceTiming with her husband, who was also hearing impaired, and he was sign languaging to the husband. And this is just such a vital part of being in the community. So no, are you reaching the thousands of people per day? No, but if you're changing the lives of 1, 2, 3, 5, or 6, that's so important when we're looking at these vulnerable communities and you know, people who have trouble and maybe don't trust these mass sites. And so we hope that we're building trust. We hope that we're building relationships. We're definitely building community partnerships, and we're very excited moving forward with this. And so now I want Zeke to take a few moments to speak with you. He has been such an advocate for our Hispanic community and our Spanish-speaking residents. And he is on both our communications team as well as our community outreach team. And so now Zeke's going to take a few moments.
Hello, my name is Ezequiel Garcia, and I have been tasked to address the Hispanic outreach. And so I wanted to start off by sharing something that happened to me in 2020 or in 2021. We were at one of our vaccination centers or one of our outreach events. And 2 fleshly sisters drive by, and they mentioned that they're very happy for the information that we provide, for the services that we have provided to the community. But she tells me, she goes, I have to admit that a few months ago, I was fed up with you. I was tired of listening to you. All you talked about was death and numbers, and we were just done with you. So we blocked you on Facebook. So that was an interesting conversation, but at the same time, I agreed with her. I'm actually tired of listening to myself on my videos. So how do we get to this point? Well, as mentioned already, when the pandemic started in May, we had to figure out how are we going to reach our English-speaking community as well as our Hispanic, our Spanish-speaking community. And so we decided to create a Spanish Facebook account. This Facebook account reaches members in the community in Georgia, Nashville, and all of Hamilton County. We have many who live in Georgia, but come to Chattanooga to work here. So on our Facebook account, we have created over 200 videos and published those on our social media. Now, these videos are produced within the agency. They're not produced from other agencies and then shared on our account. They're in Spanish and produced here within the agency. We have also published over 400 graphics, printed material on our social media, and this has been a true game changer. We have been able to see how it has benefited everyone in our community. Something else that we did to reach the Hispanic community is we started having Zoom calls. Starting in April of 2020, we met with faith leaders in the community, and every week for the entire year of 2020, we were meeting with these faith leaders, having conversations about testing, guidance, business guidance, how to attend church but still be protected. So these were relationships that we were able to fortify in 2020. And the faith leaders were bringing back questions, concerns from the parishioners, and we were addressing those on these weekly meetings that we were having through Zoom. Something else that we did to address the needs is there is a local business owner who has several grocery stores in Chattanooga, in Cleveland, and Georgia. And we asked him, can we set up an information table at your store? And can we address just concerns that the community has? And he allowed us to do that. We were able to set up these information tables. Also, we were able to set up appointments for people. It was interesting. We would arrive to these events and there was a line already of people waiting for us to talk to us, to set up appointments for COVID-19 vaccinations. So all of the relationships that we created in 2020 were beneficial in December when the vaccine was available. And it was interesting that people would come on their lunch hour, get an appointment to get a vaccine. And I just happened to be at one of the vaccination centers the following week after making appointments for several individuals. And to see them when I was there and they would arrive for their appointments, to see their face, how they were happy to see somebody who made the appointment for them, someone who spoke Spanish, interpreted for them. This truly helped them to feel comfortable at our big vaccination events. And they were able to share these experiences with others and encourage them to do the same thing. Something that we also did is in the relationships that we had created in 2020 with the faith leaders, we reached back out to them and said, can we vaccinate at your churches? And they said, yes, most definitely. And I was a little concerned that we weren't going to have much success, but at our first event, we vaccinated over 80 people. At other events at churches, we vaccinated about 140 people. So again, these were, we were seeing the success in the relationships that we had created in 2020. We went back out to this business owner who owns several grocery stores and asked him, can we vaccinate in your parking lot? Again, I was a little hesitant, not sure if we would be successful, but at our first event, we arrived and there was a lot of people waiting for us. At that first event, we were able to vaccinate over 35 people because again, they felt comfortable at the place where they do their grocery shopping. They know the owner. So this truly helped us to establish those relationships. And now the 60% of the Hispanic community is vaccinated in Chattanooga. And that is just a good number that we can see that there is progress. Going back to the two sisters that we met at one of our events, after we had a nice conversation, she says, although we were annoyed with you and we were tired of listening to you, we have unblocked you. Something happened in their family that caused them to want to continue hearing the updates. And they said, we have unblocked you. Again, we are so thankful for your information. One of the moms has a child who is disabled, has special needs. So they needed that guidance and they were very happy that we continue to provide that. So this has been this outreach program has been so beneficial, and we look forward to continuing to grow it in the coming years and using this group to, again, fortify those relationships and offer other services to those in our community and follow through with our objective to have healthy communities and especially in our area. So again, thank you so much for inviting us. We're going to open it up to questions and comments. If you can just let us know who you're addressing it to, and we can have that individual come into the screen.
That is great. Thank you all so much for your presentation and your time this morning and giving us some more information. We know the last 2 years with COVID has just been a new horizon, new world for all of us. So thank you for all the work that your health department, this health department has done to help just our whole community navigate through masking and vaccinating and contact tracing. So very much appreciated. I do not see any questions in the chat. Let me make the screen here. Are there any questions? I don't see any hands raised. So if you have any questions, please feel free to raise your hand and ask or put them in the chat box. I am not seeing any. I actually have one for you. I would like to know, kind of as we're starting to see COVID numbers go down, what are your plans for hopefully being able to transition more out of doing COVID things, and this can be for anyone, back into more your, do I dare say, normal public health type programs and initiatives? What does that kind of look like?
That's a great question. I'm going to give that over to Diana Kreider. One moment.
Okay, that is a great question, and one that alluded to a little bit that we're struggling with, because what we started with before the pandemic is not where we're at today. And as I mentioned, we pretty much tore down all of our services in order to deal with the pandemic. And so some of the challenges we face is our clinic facilities are there. We're working to get staff there. We've had a huge turnover in staff, as I think probably most healthcare entities or businesses during COVID. And so questions that we're asking ourselves is, what's needed in the community? We have our core public health services that we will be offering, but for example, we do pediatric primary care at our Sequoia, our Saudi clinic. I'm not really sure if that's where we need to be in the community now. There's been a lot of changes in the Saudi area, just as there were a lot of changes in the Ottawa area. And we made the decision several years back that we did not need to offer primary care out in the Ottawa area because there were plenty of providers. And so we wanted to take our resources and utilize them in areas that really did need primary care for families. So one of the things that we're doing is our epidemiologists are now trying to look at data in our community and determine, like for that pediatric care, is there a need? And yes, if there's a need, where is that need most likely going to be beneficial to our community? So that's one of the things that we're doing. The other thing is people are not used to us being there. And so it'd be great if we could just send staff out to our clinics, open the doors and say, ta-da, we're here. But that doesn't work that way. And so we have to build a relationship back with the community and get that trust going again. And COVID will continue to be a part of everything that we do. And we have to figure out, as I said earlier, figure out how do we live with COVID? How do we make it integrated into a normal part of our services? Right now, what we did was I think I mentioned we had our vaccine site, and it had been at the River Park for, I'm thinking maybe a year or so. And people were used to being able to get in their cars and come down, not have to get out of their car, 5 minutes. Everybody comes to them. And, initially people didn't like that. And we took a lot of flack for that's how we were doing it. As we've said, now we don't have enough people coming to warrant keeping up that facility. We brought that service into our main facility, and it's separate. People can just walk in. And we're still doing Tuesday through Saturday to try and reach the public. But it's kind of like, how do we integrate that in and have a place? Some of the things that we're doing, and we've been doing this all along, is when patients come in for, say, some of our other clinical services, like if somebody comes in for an STD service or tuberculosis or family planning, we talk to them about vaccines. That's something that we've always done. And COVID's now one of those, and we offer that to them while they're here. And we try and make it as least disruptive to their schedule as possible. So instead of having them go from one place to another, we try and bring the vaccine to them. So those are some of the things that we're doing. Our homeless healthcare facility that I mentioned, they geared up to do a lot of COVID work out of the community. They worked with shelters. They worked with, we had to work with hotels because we had to find places to shelter somebody who was COVID positive or who was in quarantine. It's really hard to figure out how to do that for an individual that has no place to go, shut the doors and isolate. And so we've pretty much incorporated that into their routine services and care. And I'm glad to say that we have very few people in the hotels right now. So those are some of the things that we're looking to do. We'd like to hear from the community. We'll probably do assessments, look to the State Department of Health to give us guidance and that sort of thing. So does that kind of give you an idea of where we're at?
It really does. And it's fair. Let me ask one. Go ahead and ask your question. Then I have one more question to ask too. So ask yours first and then.
Sure.
So I was just going to ask, we have a lot of nurse practitioners at this conference or future nurse practitioners. And so when they're seeing patients, what is one thing that you would want them to tell their patients about the health department? Because you did a great job of explaining a lot of services today, but sometimes the lay population right now, they maybe know COVID testing and vaccines. But if they come in, they say, okay, health department seems like a huge umbrella. What are some major things you would want, just a couple bullet points for providers to know, to tell clients, okay, here's where you should go to the health department for these. You should check out the health department to help with these services.
That's a great question, and one that we always struggle with trying to partner with other providers, whether it's nurse practitioners, students, med students. I think one thing I'd like to tell people to think about is your health department is a really valuable resource in your community. And we have, typically we do something for everybody in the community, whether it's that safe water or the fluoride in the water, or it's an actual service. So there's a lot of tangible services that we can provide in our clinical areas. But I do want to say that we always try and encourage a person to have a medical home. And often that's not with us, and that's okay. We're okay being a supplemental piece. There are things that we can offer, like car seat safety. If somebody's pregnant and they need a car seat, we have a program that works with that. We have, there's a smoking cessation program for pregnant women that we work with them. And as they continue through the program and they stay off of tobacco products, then they can get vouchers for diapers. So that's another thing to connect them with. We have a case management department that does a lot of assistance and referral into other resources. So probably I would say at this point, our website is probably the best place to look. But if you don't know, call us. And especially right now when we have our hotline, I can't tell you how valuable that hotline is in finding resources for people. Hopefully that will be of help.
Yes, thank you.
Yeah, thank you. And then, so there's a question in the chat that says, one, thank you for all you do. That's a compliment from HEF 48, thanking you for all you do at the health department. And then a specific question, is there a specific page on your website that lists all the things you provide other than the departments? So I put up just your
I'm going to turn that over to our web people here.
Okay.
This is Holden.
Okay, and if you want to put in the
Hello,
chat
everybody.
like a specific page, Tracy Hefner.
Yeah.
Thank you, Tracy. Yeah, so is there a specific page that lists what you provide?
So on our website, it does break it down by departments, but in those departments, it lists all of our services, right? So within our health promotions, for example, it lists the tobacco cessation program, it lists the baby and me program. Also, in addition to that, we have our communicable diseases program. So under those different departments and under those different tabs, it lists all of the things that we have available for us.
I also want to say on the Chattanooga Care Connector, each actual physical location of the health department is listed on the website by location and what services are provided at that location. And we confirm that with the health department because it does vary by location. I see another question from Dr. SR in the chat.
Yeah, so another question.
And that's a great point. If I can
Sure.
Sorry, if
Yeah,
I
yeah,
can interject real quick, that is a good point for a plug for our vaccine calendar. We have an online Google vaccine calendar that actually lists out all of the different places our strike team with Renee and Ezequiel are going to be, but it also lists out all of our different outlying clinics and the vaccines that folks can find at those clinics as well.
Okay, great. Thank you. Okay, so another one is from Dr. Sims Robertson here. What about the inexpensive STD testing? That's important because it's expensive to order if you don't have insurance. So y'all, I know having to play musical chairs there. Sorry about that. Yeah, so what about your STD testing?
That's okay. Okay, so we do STD testing through our main STD clinic, obviously, but also that service is available either through our primary care services or our family planning program. So for example, in the family planning program, that's a sliding scale fee service. And so individuals qualify based on family size and income. So that's what their charges would be. We typically ask people to pay, but if they don't pay, we go on about it and they can pay when they can. We don't refuse services because they didn't pay. In our STD program and clinic, we receive, that's a state-run program. And so we are provided medications and things like that through that program. If somebody is a contact to a positive case, whether it's something that we've diagnosed or a provider out in the community has diagnosed, I believe that there is not a charge for those STD services. Now, if somebody wants to come in and just get checked, they're not a contact to a case. I want to tell you, and I'm sorry, it's been a minute since I've looked at that, but I believe the fee is either $10 or $20. That's for Hamilton County residents. Now, if there's somebody from out of state, there is a full charge for that, just that voluntary service. But again, if they're a contact to somebody, then we have a process to pay for those services for them.
And I'm gonna.
Does that make sense?
Yeah, it does. And I'm gonna piggyback with that from STD to contraceptives, that you all provide free or low cost contraceptives as well.
Absolutely. Yes, we do.
So
we have the LARCs, we do the, yeah. And those family planning services are available right now. They're by appointment because we have limited providers, but they are available at our Birchwood, Sequoia, and 3rd Street facility. We're hoping to get our Ottawa facility up and running a little bit more robustly and be able to offer family planning services there really soon.
Okay. And one more question. They keep coming in the chat. Our
Great.
low cost, I'm sorry. Who did I interrupt?
No, I just said that's great. Thanks.
Oh, okay. Are free or low cost child vaccinations also available?
Yes, they are. We are part of the VFC program. We do, again, sliding scale fee for those who are not qualified for that program. We do accept insurances. And those childhood vaccines are available at all of our clinic sites like Ottawa, Birchwood, Sequoia, and here at 3rd Street. And I do want to just say a concern that I have as a public health provider is that because of the pandemic, a lot of people have not gotten care for health needs, haven't sought treatment. And so we probably have a lot of, our vaccine rates are going to be very low. One of the things I also think we're probably going to have is probably a high unintended or high unplanned pregnancy rate. And our STD rates are pretty high right now. So all things that we're concerned about, what that looks like for the health of our community as we go forward.
Okay, any other questions? I don't see any other hands. All right,
we appreciate everybody's kindness and attention.
Yes, thank you so much. We appreciate y'all being willing to do a panel with us this morning and provide these great information and resources. Yeah, and visit the hamiltoncounty.gov. The site's been put up a couple of times now. So I'm trying in chat if there's websites or links to put those in chat so folks can kind of cut and paste and create a Word document of resources. So thank you all very much for your time this morning. Really appreciate you and your information.
We really appreciate you all. Let me also just quickly say, if I could, if there's an entity that is interested in working with us, if they'll just reach out to our administrative offices, then we can figure out who they need to connect with or what we are able to do with them.
Yes, I'm going to be reaching out to y'all again as well. I know we've kind of been back and forth with COVID vaccines and that sort of thing, but I'm thinking DNP projects. So, and what can we help with quality improvement?
We welcome that.
So you will be getting emails from me for sure. Okay.
Great.
So
thank you.
Thank you so much. Okay.